Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here. I'm coming to you from the gym this morning, just with a little Monday kind of motivational, educational moment. Just encouraging you to get out there and go start some physical activity. Today I did 2 miles on the treadmill. I got new shoes, so I'm actually working on breaking them in. They have new inserts, so actually wear the inserts for part of the run and then put the old ones back in and just kind of taper until my feet are used to the new extra stability that I got in these shoes. I want to show you a really cool, my favorite exercise. I always tell my patients, okay, I think you're ready for my favorite exercise now. So I'm going to show you the beginning stages and a few progressions you can do just to work on toning the core, the bottom and the legs. That's why I like it, maybe, is because it kind of gets 3 areas at once. It's really good for my running. I tend to have some hip weakness, and that leads to knee pain and some actually low back pain too sometimes with training or just running a lot. And by a lot, I mean like 3 miles 3 times a week. So I think I got this where we can see the exercise. So it's called a bridge. So you just lay down and lift. The progression of that is to add a hold. Be careful with the neck. Don't push through the neck muscles. The head should be really relaxed. Don't use a pillow or anything with this. Another progression is going to be to lift, have a leg out, or you can actually do the whole single leg bridge. Okay, y'all, so bridge, the progression is just to do a bridge and repeat. You want to tighten abs first. The body should be like a plank. It's okay if you don't go as high as me at first. You ideally want to get level out eventually, but if you're just starting, make sure you're engaging your glutes and not pushing through the neck and the upper body. Progression is to add a hold. Actually, we treat those like planks sometimes and just hold them 30 seconds. You can add a ball squeeze between the knees if you feel like that helps you engage abs and core a little bit more. Another progression is to go to single leg. And then also kind of that march thing that I did where I had one out and then the other out. If your body's not staying level, your core's not tight enough and not ready to progress to that. Hope everybody has a wonderful Monday. Get out, get moving, even if it's just a short walk. I do advocate for slow progression into an activity program. If you're starting new, maybe just 15 minutes. Make sure your body handles that. And if you're having pain that prevents you from going out and doing this, you should probably see a physical therapist. Have a good Monday.